what is the final goal of the project Youth Prevention Influencers. But maybe first, to put it in the right frame, where did we find that idea, and what motivated us to take that over? Some 10 years ago, United Nations started to transfer responsibility for mental health from older generations to youth. And there started a big movement of responsible youth with a drive, with engagement, as a kind of ambassadors for mental health. And they started to unite, to meet at the yearly meetings of the United Nations in Vienna. And this group was growing and took actions more general on mental health. This is very interesting because at the same time, some years ago, Rotary International put mental health as a priority for Rotary International. So this fits in the same topic. And at the same time, Rotary International, many years already put the accent on renewing Rotary clubs, making the clubs younger. So mental health and young people are themes that are very interesting for Rotary International. I met those young people during the conferences of the United Nations Office for Drugs and Crime, which we follow with Rotary Action Group Addiction Prevention year after year. And the last 3 years, I saw that there developed within the group of Youth for Mental Health, there was also a group Youth for Addiction Prevention. So I learned to meet those people and those organizations involved in it. And at the same time, we had in Bruges a youth project with the name A Joint Effort Project, where Rotary clubs collaborated with 5 clubs of Bruges to train youth leaders from youth organizations to start with a drug policy in their organization. And this is already working for 15 years, so much longer than those organizations existed. And we were looking at that moment to actualize the project, to give it a new input and a scientific basis. And at that time, I met those young people working on addiction prevention. I said, okay, this is the right mix. And we started to develop the project Youth Prevention Influencers. And we cooperate with United Nations section Addiction Prevention, with the World Federation Against Drugs, and at the local level with national umbrellas for youth organizations. Because the project should grow to youth, for youth, by youth, and we saw our organization, Rotary clubs, Rotary districts, as facilitators, supporters. We can help young people to take their own action after that they have learned about principles on addiction and principles of evidence-based prevention. We can help them to start their own actions with the network we have, the influence on local levels we have, and especially with the finances if there are costs to the project. So I think this project is fitting in every Rotary club everywhere in the world, and it's the problem #1 in the world. If you look at mental health, and that's a priority now for Rotary, then we see that within mental health, addiction is the biggest problem in mental health. And addiction is a big problem because if we look at tobacco, we have 8 million deaths per year on the world. If we look at alcohol, it's 2 million deaths a year. And at the contrary, people think that substance abuse gives a lot of deaths, of course, 600,000, but much less than you would expect. At the contrary, the problems and the social impact of substance users is much bigger than this of alcohol users, which is on its term much bigger than the social impact of smokers, cigarette smokers. So, but the total, we speak about 11 million deaths a year only for addiction, which we can prevent. And to say it in Rotary terms, the youth prevention influencers and the social skill trainings, we call that the vaccination against addiction.